every angle. This is Arise America.
Tufts University has launched its first ever Centre for Black Maternal Health and Reproductive Justice. Its aim is to protect black women in the US through the birthing process by advocating for quality care. The centre will focus on research and community engagement to tackle structural racism within the health industry. Just to show you how dire the situation is, let's give some data. Now, black women are 2.5 to 4 times more likely to die from pregnancy-related complications than white women. And for every 100,000 live births, about 37 black mothers do not survive. That's compared to around 14 white mothers. Ndidiamaka Amutah-Onukagha, a Tufts professor and the powerhouse spearheading this landmark department, says that, and I quote, "The country is in a crisis around maternal health," unquote. So what can we expect from this new and unique initiative trying to right historical wrongs?
Really, I'm a revolutionary that just happens to be housed in the academy. And my goal is to take the resources of these institutions to the academy. So, I've been in Boston for a few years now, and I think for me, what I'm noticing here in Massachusetts is there's tremendous opportunity to address the systematic and systemic racism and oppression of Black and brown people. And one thing I will say, in a place like Boston, that's a healthcare mecca, we see so many resources, we see tremendous facilities and tremendous opportunity. We know that Black and brown women are still being marginalized, still being mistreated, still being discriminated against in labor and delivery when they go into the hospitals. And for me, it really has been quite humbling and quite surreal, but also very reaffirming. In my own labor and delivery experience, there definitely was, shall we say, some missteps, some missed opportunities. And so for me, I just feel a very urgent need to dismantle this system. Massachusetts often rests on its laurels as a place that has so many resources, but when you really look at the data and you look at the rates by race, we know that Black and brown women are still being mistreated. And we know that overall, the United States is failing horribly at addressing maternal mortality in communities of color. Really, I'm a revolutionary that just happens to be housed in the academy.
Well, the founder and director of the first ever Centre for Black Maternal Health and Reproductive Justice to launch at Tufts University joins me now live from Boston, Dr. Ndidiamaka Amutah-Onukagha. I do apologise if I've got your name slightly wrong. I can be a bit too British at times, so my apologies. Thank you very much indeed for joining us. Can you tell us more about the centre and how it will help black communities?
Good evening. Thank you for having me, and day well to all my people. The Center for Black Maternal Health and Reproductive Justice will be focused on addressing the critical crisis that we're experiencing here in the United States around maternal mortality and severe maternal morbidity. The thing about Black and brown birthing people in the birthing process is that in a country like the United States, where we have access to resources, technology, highly skilled clinicians, there are other things at play that are killing and limiting the life expectancy of Black and brown birthing people. So what do I mean when I say that? I mean, I'm talking about microaggressions, I'm talking about racism, I'm talking about delays in treatment, I'm talking about, dismissing of symptoms of Black and brown pregnant people. And so the work that will come out of this National Center for Black Maternal Health and Reproductive Justice will be focused on addressing those issues through research, creating and providing opportunities to the latest evidence-based and community-engaged research, policy, legislating for bills and enacting policies at the state, local, and federal levels, and doing a lot of work around reproductive justice, mobilizing communities, working with and for communities of color, and training students, clinicians, nurses, midwives, public health professionals, researchers to go and combat this major systemic problem. So it's a national center. It's the first of its kind here in the United States, housed at a medical school. I'm proud and honored to be the inaugural founder and director. And the work that we have in front of us is timely, it's urgent, and it's necessary.
Now, I mean, there's always been evidence that there's been a disparity in healthcare in the US, but it seems to have taken the COVID-19 pandemic almost to bring this into a subject, to bring this into the full frame. I mean, why has it taken so long?
It's taken so long because I think a lot of people in this country have had the luxury of resting in a place of privilege and have not had to focus on this issue. When we saw the brutal murders of George Floyd and Breonna Taylor and so many other Black and brown people in this country that were captured on live video footage, I think when that happened during the pandemic, at the height of the pandemic, it really just woke people up. It shook people into a place of action and said, what is going on? Why are people dying at the hands of these incredible situations that can be avoided? How is racism, systemic racism, how is oppression operating here? So we see that happening in Black and brown communities, and we also see it happening in the hospital system, right? Black and brown women are 243% more likely to die from pregnancy-related complications. And the complications that were happening before the pandemic were exacerbated. So the pandemic was just something that just showed a light on something that was already happening, that was already taking place. But now we no longer had the privilege and the luxury of acting like it didn't happen. The pandemic was a bit of a leveling playing field. Everyone was sent home. Everything was shut down. All economies lost revenue. Everything was upended and nobody was safe. See, the pandemic didn't have a particular focus on Black or brown. It affected everyone. It disproportionately impacted other communities of color, but it affected everyone. And so you have this dual pandemic happening in this country, the COVID-19 pandemic and the pandemic of racism and discrimination. Both of them coming together at the same time created a perfect storm for us to really highlight and focus on these issues we're talking about.
Now, and you mentioned George Floyd and Breonna Taylor, obviously that highlighted, but also if we look at to other potential aspects and potential role models, since, for example, Kamala Harris, Oprah Winfrey, who's also looking into healthcare, even Serena Williams in the past writing open letters. I mean, are these good role models in the community to basically help make awareness? Has their actions that they've taken helped to push this message that basically more work is needed here?
Tremendously impressed and honored with the work of Vice President Kamala Harris. My office has been in communication with her office. We look forward to welcoming her to the Center for Black Maternal Health and Reproductive Justice. We've also done a lot of work with some other senior level officials, such as the administrator for Center for Medicare and Medicaid Services. She spoke at a national convening I had last week. I've also done work with Senator Elizabeth Warren and her office, some of our state representatives, Liz Miranda, and our Congresswoman who's in the House of Representatives in DC, Congresswoman Ayanna Presley. These are colleagues and friends of mine who are doing this work at the state, local, and national level, and I'm honored to be in community with them. I would love to be in partnership with Oprah and what she's doing and her increased focus on health equity. And also the case of Serena Williams, who is such a global superstar, a tremendous athlete that we almost lost during her postpartum period. She was suffering from a blood clot in her lung. And when she raised this issue with her provider, the doctor and the nurse told her to go and lay down, that she was confused and disoriented from just giving birth. Now, for those of us that have given birth, you may be tired, but that doesn't make you confused or disoriented. And so with the case of Serena Williams, we see a global superstar athlete that we almost lost at the hands of racism. What's most striking about her case is that for Serena Williams, this was something that was documented already. Serena was already being treated for this blood clot. She had to stop taking the medication because of her pregnancy. So this was something that was in her medical record. But at the time, her care team dismissed her symptoms. They undermined her symptoms. And so we see that her case is particularly jarring, given her resources, her access, her global superstar status. But in that moment, she was treated like most Black and brown patients are treated, with discrimination and disregard. So her case is particularly striking.
And before you go, I mean, basically, Tufts has set up this facility. I mean, are you hoping that this is going to be a model not just for the US, but basically for the rest of the world to look at? Because this isn't just a problem in the US. There's a disparity in other parts of the world. Is the aim to be a showcase?
Yeah, so the work that we've been doing to bring this center to life has taken a lot of time and a lot of hard labor. And I think for me, I'm excited to set a new precedent for what it looks like to do maternal health equity work with a focus on social justice. So as you rightfully said, the issues that we're grappling with here in the United States are not germane. They're not unique to the United States, although it's more striking because of the tremendous resources that a country like the United States has. So what we're doing with the center will absolutely be a national, international, global model for how do you work within and for communities? How do you center pregnant and Black and Brown patients? How do you prioritize their needs? How do you train clinicians? We're going to have a training arm of the center. How do you create and disseminate evidence-based data? How do you work with state and local and federal policymakers to push legislation forward? And finally, how do you train students who are going to be the next generation of scholars, of activists, of clinicians, of midwives? So the model that we're building here in the Center for Black Maternal Health and Reproductive Justice will be a prototype for other universities, other countries, and other institutions looking to address maternal health from a reproductive health and social justice lens. So I look forward to continuing the conversation, and please find us on social media for more information. We're just getting started.
Well, sadly, we'll have to leave it there, but congratulations on the launch of the facility.
So
and please keep us informed with all the developments. We would certainly love to have you back on the show and basically discuss the progress that you're making, because it's about time that we see progress and head forwards, not backwards. But thank you very much indeed for joining us this evening.
Every angle. This is Arise America.